After setting up the landscape for motor development, now we dig into the details of motor skills as they begin prior to birth. Module 5, Prenatal Concerns. In the first module, we established that movement is critical to being human. This module discusses how this is true prior to birth. The following are terms students are expected to know by heart: critical periods, teratogens, genetic factors, maternal nutrition, and exercise during pregnancy. Again, this is an overview. Please note, the following will not be included in any assessment for this course. Prenatal diagnostic procedures is the domain of clinical practice. We will not discuss this any further. What is the most critical period in gestation? Note, the term used is gestation. This refers to the period from conception to delivery. In other words, pregnancy. The organism is most vulnerable during the embryonic phase. It is the period of greatest susceptibility. Take note that the different books and sources will tend to use and interchange terms such as embryonic, epigenetic, and first trimester. For our purpose, all these terms correctly refer to the most critical period of pregnancy. But they clearly have specific clinical meanings, and the time boundaries do not necessarily align. However, they certainly overlap. In animals, the embryo is the organism during the early stages of growth and differentiation. This is characterized by the laying down of fundamental tissues and the formation of primitive organs and organ systems. The individual from the time of implantation to the end of the 8th week after conception is when it is called an embryo. If you want to be more technical about it, during the first 2 weeks it's called a zygote. For our purpose, we are happy just to use the word embryo. Okay? Specifically, a developing human is a fetus from about the 9th week onwards till birth. Full gestation is not 8 months as the lay population typically describes. Technically, it is between 38 to 40 weeks, which does not fully conform to the 9-month accounting. Students in this course are not lay population. You are expected to use the correct technical terms from now on. Do the math. 9 months does not equal 38 weeks at the very least. You will come up short at 36 weeks. There are procedural consequences related to these definitions. Typically, an infant born below the gestational age requirement of 37 weeks are considered preterm babies. In this case, the baby is mandated to be placed at the neonatal intensive care units. This assures that they're given all the necessary care to survive the world upon discharge. The two processes of growth that take place are hyperplasia and hypertrophy. What are the differences between these two terms? Which one is characterized by the increase in cell size, and which one refers to the increase in cell numbers? Exercise science students are responsible for finding out the answer, and students should know this principle by heart. We will revisit this growth issue in a later chapter. Therefore, it is critical that you know the differences between these two terms and keep them in mind starting from now. The other term used to describe the critical period is epigenesis, or the epigenetic period. The process essentially happens during the embryonic phase. Organs, systems, and body parts differentiate. Take it from the root word genesis. Genesis, in biblical terms, means the creation. Thus, when body parts differentiate, a whole system is created, like the cardiovascular system, the muscular system, the neural system. And as this progresses, the organism takes the form recognizable as the human. However, the findings that cemented the epigenetic period per body part and per system came inadvertently through one of the saddest scientific inquiries in history: thalidomide babies in Germany. The results of this study cemented the idea that damage severity depended on the timing when the drug was ingested. At that time, German doctors fully documented when they were giving out these anti nausea drugs to pregnant women. It turns out their record keeping was very accurate. They were able to track exactly which body part ended up being damaged when the drug was given at a particular time. Developing drugs at ingestions experience the worst effects. A table in your text outlines the general findings and pretty much is being used by all doctors to chronicle which body part is developing at that point. In terms of direction or developmental progressions, two trends are noted. Just like hyperplasia and hypertrophy above, you are expected to understand cephalocaudal and proximo-distal. Both these terms have Latin origins and refer to anatomical landmarks. Which term refers to center to periphery type of progression, and which term refers to a head to tail progression? Based on their anatomical backgrounds, you should be able to identify these, and the terms are easily searchable online. Students, take control of your knowledge. What are the possible threats to development during this critical period of gestation? The first that we will discuss is teratogens. Its Latin origin allude to environmental agents that could potentially harm the developing fetus. Terra or tierra means earth, gens means agent, thus agents in the environment. If teratogens are present in early gestation, or what we've described as the embryonic stage, there is an increased probability of both structural and functional defects. Even if exposure to teratogens occurred in later stages, the effects could still be significant. Teratogens may result in profound functional delays. From here on, we will discuss the common teratogens that pregnant women have to contend with. These are recreational drugs, drugs and prescribed medications, and maternal diseases. Let us begin with the most common recreational drugs outlined in the text. These are alcohol, cocaine, tobacco, cannabis, or what you know as marijuana. Substance dependence in any of these four will share a common consequence for the developing child. This is having small for gestational age infants. The lay population will typically use the term low birth weight. However, this does not accurately describe the condition. Absolute birth weight is not meaningful without the time element taken into consideration. Time is always consequential in motor development. Time is embedded. Thus, weight must be related to how long the child developed in gestation. Therefore, the proper term is small for gestational age babies. A child who may only be 4.5 pounds, but if he had only 30 weeks of gestation, this is remarkably positive. On the other hand, an infant may be delivered at full term, at least 38 weeks of gestation. In other words, it is not premature, but weigh the same 4.5 pounds. This has to be taken in a more somber light. Before us are two brain samples from infants of the same age when they died at 6 weeks old. Clearly, the brain on the left looks normal in size and appearance compared to the one on the right. Which drug do you think did this damage? If you thought alcohol, you are correct. In addition to the size differential, what qualities of the brain on the right could be the potential basis for mental retardation? Note the absence of extensive folds in the gyri, the asymmetry, and the odd way the hemispheres are put together. Specific brain structures are greatly reduced in size or terribly damaged by alcohol. In this figure, the differences between a normal-sized brain and those of infants with FAS or fetal alcohol syndrome is shown beyond just discussing the size. In other words, the arrows in the picture point to specific structures in the brain that are different based on the effect of alcohol. On the leftmost figure, this is a normal brain, you can see a very well-defined corpus callosum. What is the corpus callosum? Corpus callosum is the thick band of fibers that hold the brain together. On both the middle and the right figures, either the corpus callosum is severely misshapen or it's almost non-existent. It should not surprise you that ADHD is a logical consequence or the result of having a damaged corpus callosum. Under the microscope, evidence of major damage to brain cells were found when alcohol was introduced. Instead of axons and dendrites finding each other, they overshoot and do not make healthy connections. Is it any surprise, therefore, that the cognitive capacities of children with FAS exhibit profound cognitive deficits, in other words, mental retardation? So, what is more alarming is a scary set of statistics about pregnant women. Of those who were surveyed, 3.3% of them admit to being heavy drinkers. Women continue to ingest alcohol during their gestation period. Not only that they drink, but the admission of heavy drinking is rather disturbing. Low to birth weight is due to overall growth deficiency, not only of the body, but also of the brain. The worst cases of infants born already addicted to alcohol are described as fetal alcohol syndrome. They exhibit all the withdrawal symptoms of junkies that is typically associated: tremulousness, hyperactivity, and irritability. In addition, there are associated sets of craniofacial anomalies and mental retardation that comes along with FAS. As previously mentioned, diagnoses of ADD or ADHD are highly associated with alcohol abuse. There is, however, a less severe version called FAE, fetal alcohol effects. Although these infants may not have the structural defects associated with FAS, they exhibit similar symptoms nonetheless: severely hampered fine motor function and motor performance delays. Here is a caricature of the structural damage that alcohol brings. Because of the underdeveloped brain, the size of the head is significantly smaller. There is a tendency for flat face and the eyes being farther apart than typical. That is what is meant by craniofacial anomalies. Cranio meaning the cranium, and then the face. The results are quite consistent. Since 1997 and up to this day, attention deficits are the most consistent neurobehavioral effect of prenatal alcohol exposure. What does Coke have to do with cocaine? Well, Coca-Cola was introduced in 1886. According to their ad, it is a valuable brain tonic and a cure-all for nervous afflictions. It was promoted as a temperance drink, offering the virtues of coca without the vices of alcohol. Until 1903, a typical serving contained about 60 milligrams of cocaine. Sold today, it still contains an extract of coca leaves, which are used only for flavoring since the drug has been removed. So what are the effects of cocaine on the developing embryo? Cocaine is a form of a stimulant. In other words, it's an upper. What comes along is a laundry list of possible consequences, number one of which is the probability of miscarriage. It will induce faster heart rates and it will produce a wired sensation. So not only does the mom get all of these highs, but the baby itself will be experiencing the stimulative effect. Consequently, there's a probability of fetal brain damage. Fetal damage, fetal brain damage comes along with the reduction of oxygen supply. There's greater blood pressure fluctuations. And ultimately, because of the fast heart rates and inability of the fragile system to cope with the stimulus, brain hemorrhaging may occur. On the other hand, along the placenta, blood flow may be cut off. This directly leads to the loss of weight or mass because essentially the nutrition that the baby requires, the nutrition that the embryo needs, is not being delivered. And in some cases, placenta separation occurs, bleeding follows, and a potential death is at hand. The baby is basically born a junkie. It will be jittery and irritable with minimal provocation. In addition, there is a high probability of SIDS. What is SIDS? Exercise science students should know what this is. Sudden infant death syndrome. Given the availability of tobacco and the sheer number of people engaged in this habit, many mistake smoking as possibly benign, especially compared to drugs like cocaine and marijuana. It is thought that it has minuscule effects on the growing fetus. And yet, empirical data show the following possible effects of smoking, and given all these risks, it is anything but benign. It is not harmless. You've already been told about birth weight, loss of birth weight. Please insert SGA there. That's the proper term. But on top of this, data shows that infants exposed to tobacco have the highest mortality at birth, in addition to the maternal complications that occur during delivery. The probability of miscarriage is also very high, and here again you meet the acronym SIDS. You know what that stands for now. In addition, nicotine poisoning is highly probable if the baby is breastfed from a mother who continues to smoke. Probability of fetal hypoxia is also there, given that one of the residuals from tobacco smoking is carbon monoxide or carbon monoxide. Instead of oxygen binding with the blood, if carbon monoxide is present, it is most likely going to cut off oxygen supply. Therefore, the brain again is vulnerable to damage. With all of this, increase in respiratory diseases are highly probable. Bronchitis and pneumonia for a very young infant is terrible. After tobacco, the last drug that we're going to talk about is cannabis. Not much is written about it in your text. What is clear, though, is that it is associated with low birth weight and SGA infants. Here are pictures that highlight the differences in size between premature neonates and those that are born full term. While no direct comparisons are being made, as clearly these two infants are of different ages. The picture on the right shows a baby fitting on a palm, just as the one on the left. However, note the more fleshy appearance of the one on the right shows it's perhaps several days or weeks older than the premature infant on the left. For comparison, however, below is the 3-month-old baby. That is what a normal baby should look like. It has to be covering at least the whole forearm of the one who's carrying it. Moving along. Other teratogens that could harm the fetus include prescriptive drugs that are especially difficult to handle, as mothers of pre existing conditions critically need them. Small doses of powerful drugs directed towards specific areas of the brain for the mother. Note, it's good for the mother in conditions such as depression, epilepsy, diabetes, etc. These are powerful drugs nevertheless. They may have profound effects on the child. Likewise, disorders stemming from the endocrine system may damage the fetus. We are talking here about drugs that have to do with the thyroid, very powerful glands that have direct consequences to the neural system, and also a condition such as that of diabetes. These are very difficult conditions to manage, thus requires careful titration and supervision by the doctors. Timing is critical. Note that this is the lesson gained from the thalidomide babies episode of history. It is not only prescriptive drugs that are potentially damaging. Even the non prescriptive drugs or over the counter drugs can have devastating effects. Aspirin, in particular, close to the delivery time, is to be avoided. Aspirin, as a blood thinner, will promote bleeding and will promote prolonged labor. Therefore, the potential damage to both the mom and the fetus have to be carefully monitored. Alcohol and cough medication is another one that have potential effects on the brain of the child. There are a number of other teratogens that are all potentially available in the home. Simply look under the sink and you will find a host of possible noxious ingredients. New carpets are sprayed with fire retardant chemicals, for example, and many of them find their way to lactating mother's breast milk. A study shows higher concentrations of potentially harmful chemicals in the breast milk of mothers in the United States as compared to their European counterparts. We already discussed carbon monoxide in relation to tobacco smoking. Finally, radiation. There are three historical events that have documented the massive and devastating effects of nuclear radiation. Two atomic bombings in World War II in Japan, and the nuclear meltdown that occurred in Chernobyl, formerly a Russian territory, attest to the devastating effects of radiation. Many pregnant women who live in those places, if they survive, they and their children have shorter lifespans. Brain development and cell migration altogether stopped. Unlike the effects of alcohol in brain cells, where axons and dendrites don't find each other or the overshoot, brain cells affected by radiation simply stop. They don't grow. A generation of children, if they survive, will be born developmentally atypical and clearly delayed. In terms of maternal diseases, there's a whole host of them that profoundly affect the infant, from mumps to German measles to rubella. However, the recent advent of HIV, you are expected to know the meaning of HIV. It will not be shown in this slide, but you ought to know that it has to do with human immunodeficiency virus. This jolted the medical community, and the consequences in the children can be devastating. Thus, the focus of HIV in this chapter. Not all infants born of mothers who are HIV positive have AIDS. However, the probability is high if the mother is HIV positive that she will pass the virus on to the child. There are, however, miracle babies that have been discovered. Should the infant contract the virus because of a compromised immune system, the body is defenseless. With a virus whose nature mutates, the HIV condition and cure is to this day elusive. However, management has been better. As exercise scientists, our concern are the movement consequences. Yes, they do have short lifespans, but for practical purposes, these children also have very clear weaknesses. Spasticity and rigidity is quite common, and muscular weakness as well. In the most high profile participation of an HIV positive basketball player, like Magic Johnson. During the 1992 Barcelona Olympics, his own teammates and other international players protested in his presence. Obviously, Magic Johnson is still alive. He is the beneficiary of the advancement in sciences. Sadly, not everybody has the same resources he has. Think about the consequences of having a kid in the class that you teach who is HIV positive. What kind of activities will they be allowed, and what kind of interactions will be monitored between them and the other kids? Those are real practical issues to be dealt with. Now that we are done with teratogens, we proceed to other threats to developing fetus. We start with maternal nutrition. What is the right weight to be gained during gestation? When this is typical or normal, then the average weight to be gained during gestation is between 25 to 35 pounds. Each mother will adjust to how much they need to gain weight depending on their own conditions. If they're overweight, they do not need to gain as much as 30 pounds. If they're underweight, it might be a good idea to gain more than that. What is most important for the mother is to have the proper nutrition. Importance of dietary protein and fat needs to be highlighted. Protein is clearly important because it is a building block for cell growth, not only of the cells, which is obviously for central nervous system development, but every other body part. Fat is particularly important because brain cells are essentially made of fat. Inasmuch as ordinary folks cannot do without fat in their diet, how much more for the pregnant woman? It is with caution, however, that I ask you to review what hyperplasia and hypertrophy means. It is not a good idea that there's too much fat, because hyperplasia and hypertrophy are two growth mechanisms that can potentially lay the ground for obesity even before the baby is born. There are particular consequences for small for gestational age infants. SGA is highly associated with mental retardation. Because of the global shortage of mass, the damage is also global, in other words, not localized. Whereas insufficient gestation alone or preterm births, not SGA, the most likely consequence or the most likely risk is of having cerebral palsy or CP. In this case, it is not globalized but localized. In other words, there is a particular vulnerability for the motor cortex. For a premature baby, this is where typically bleeding happens because of the fragile constitution of a premature brain with its premature vessels. However, it is too often the case that preterm and SGA conditions go together. This compounds the consequences. So if you have both SGA and preterm, the risks exponentially increase so that both CP and mental retardation may occur. As to genetic factors, following our preterm concerns, two possibilities are considered: those that are chromosome-based disorders and those that are gene-based disorders. Beginning with chromosome-based disorders, Down syndrome, a lot of them are more visible, either on TV, on your Special Olympics day. The condition is technically called trisomy 21. Down syndrome is highly associated with late age pregnancies. The 21st chromosome, that's why 21, has an abnormal third body added to the usual XX or XY pair. In Down syndrome, all cells are defective, typically, resulting in global deficiencies, including mental retardation. Add to that joint laxity and balance problems. They all compromise the ability of the kid to move. With regards to gene based disorders, one that was emphasized in the text is the cystic fibrosis genetic condition. While the chromosome based disorders are essentially an accident of nature, gene based disorders are, as it implies, genetics. It has familial basis. Cystic fibrosis involves the gene in charge of regulating sweat, digestive juices, and most importantly, mucus. That function is defective. Thus, in cystic fibrosis cases, pulmonary infections are prevalent, resulting in children who are unable to participate fully in sport and activities. Mucus tends to accumulate in the lungs, and they are unlikely to perform activities that require endurance. It is your job as exercise science students to know if you have a kid with cystic fibrosis, not to put them at further risk based on the activity that you prescribe. Finally, what are the effects on pregnant women? Exercising mothers tend to be fit, and therefore the developing organism also tends to have minimal fat stores. Thus, despite the trend of activity being reduced during pregnancy, most active moms do not gain as much weight. They still have a tendency to give birth to smaller children. Not that these children have any health concern. They're healthy, except they tend to be smaller. They are still within the normal weight range, assuming there are no other complications present. However, too much exercise can bring unnecessary risks. Injury can occur to the back given the additional weight that shifts the center of gravity forward. What is the effect? Because of all that weight in front, mothers tend to lean back and put their hips and their lower back at risk for back pain. Thus, for these moms, it is best to recommend water-based exercises. In addition, some self-regulation is needed. The growing infant has no mechanism to dissipate heat. If the mother is exercising too hard, it will essentially provide an environment where the baby can elevate the core body temperature beyond what is recommended. It is not recommended that pregnant mothers exercise to the same levels they were doing close to full capacity. Obviously, exercise itself affects the heart rate for the child. Pain during delivery. Do exercising mothers have an advantage? Apparently not. Pain during delivery did not significantly differ between exercising mothers and non-exercising mothers. However, tolerance of pain is much higher in exercising mothers. This slide is the last slide of Module 5.